Hello, I'm Francis Seeley from Enfield Climate Action Forum, and I thought I'd come on and tell you just a bit about a project that we're doing around climate change and public health and the impact that climate change can have on our health. And we're doing a project with a number of organisations, particularly the Enfield Racial Equality Council, but also with the local health authorities as well, helping us with this. So let's look at the project and what we're doing in it. It is called Climate Change and Public Health at the moment. I think we need a better name than that, and if you have any ideas, I would really welcome it. But it is something which is important for us to address. If we look at who we are, we're Enfield Climate Action Forum, and as I said, the Enfield Racial Equality Council are also involved, as is the EVA, the Enfield Voluntary Action group of people, which is an organisation that involves many voluntary groups, as EnCaf does. We have 120 groups involved with us. And what we are planning to do in this project is a number of things, but it is based largely in the east of the borough. And it's based in the east of the borough because there we find many marginalised communities live there. Many people who live in overcrowded conditions and poverty. There are many unemployed people, and their voices are seldom heard. And we know that with climate change, the people who are affected the most are the most marginalised. So I think all of us have a duty within our own borough to work with those people, listen to them, and find out how they will be affected by climate change and how their health will be affected. What we're trying to do in the project is create awareness around climate change and health. People know about health, people know about climate change, but very often they don't connect the two. Even professionals who work in those areas don't always connect the two. We want to highlight some key issues that impact on health, and we'll look at some of those. But we also want to listen to the concerns of local communities. Research I've seen shows that very often the concerns that communities have and the concerns that statutory authorities have are often two different things, and somehow we have to find ways of bringing them together. What we're also trying to do is look at innovative ways in which we can reach those groups whose voices are seldom heard in the public square. How do we do it? What methods can we use? And in a way, this is a sort of pilot to find out how we can do this effectively. And in the end, we'll produce a report with action points around health delivery and also greater community resilience. Now, some of the issues we will be looking at are clear and obvious ones. Air pollution is a big problem that affects us now, but climate change will make that worse. There's a lack of green spaces in the east of our borough, and we know that green spaces help with well-being and also help mitigate climate change. And heat stress is a real problem. You know, in Paris in 2019, hundreds and hundreds of people died because of temperatures going too high. Temperatures are beginning to get high here, and unless we have a strategy to deal with it, people will also suffer and die here as well. And social isolation is another problem. When people are living alone, then when there's heat stress, trying to cater for them, to remove them to a place of safety, or to have air conditioning that does not eat up our carbon footprint becomes a real problem. And of course, there are other issues as well, like the bad insulation of homes, the importance of active travel. Those are some of the real issues that we want to hear. But then we also want to hear what people themselves think in the communities that we're working on, because they may have issues that are more important to them in terms of climate change, and it's important we listen and address those as well. We're doing it through a number of means. One is we're developing a number of video stories, short 1 to 3 minute stories, where people tell us about their concerns. Now, we've done quite a lot of those already. We've done them ourselves. We've done them with Chicken Shed in Enfield, who have interviewed young people there. We're doing it with another organisation, 21st Digital Media, who are sending young people out with a camera to get video stories locally, so we can hear what people are doing. And by doing those video stories and getting people like 21st Digital Media to do it, then they themselves are reaching the people that we're trying to reach. Then we're also doing a number of webinar interviews and discussion. Webinar interviews are people who are doing things like Seeds for Growth, where we looked at how an organization is helping to develop community gardens with housing associations. We've done interviews with people in the local health authority and what they're doing, and we'll continue to do a lot more as well. We're also starting with focus groups. We've had one already that was incredibly successful, and we learned a lot about issues that people on that group felt important. And we have another group at the end of July, and that we also hope, because it's in a different time of the day, we'll have other people telling us about their concerns, and that will help us develop community panels, which is the next thing on the list. We're planning in September and October 2 community panels. One is one in Artist Hive in Edmonton, on the border of Edmonton and Tottenham, and the other one in the Forest Road Health Centre. And those community panels will be centred around doing a number of events or items during the day, like active travel, like the lack of green space, like the problems of air pollution, and then engaging in a discussion with people who come to those particular issues around what they think should be done, and then doing a survey with them to see what they think is the most important issues that they think that they should face. Now, we're hoping to get quite a few people at those panels, and we may also use those panels to see if people want to form or join or develop what's often called a climate cafe, where people who are anxious about their future in a world of rising temperatures, they're anxious and it affects their stress levels, and they just want to come together and talk to it. And climate cafes are developing across the globe where people are doing that. And we might use the community panels as a way of also inviting people to form local climate cafes. We're also working with other organizations. Chicken Shed is going to put on a mini panel with us where young people can talk about their concerns about climate change. We're going to do a live podcast with 21st Digital Media in Edmonton Green, where people can be interviewed about their concerns and do the survey as well. And the survey that we're doing and that we're developing now will be a very simple one, but it will give us an indication of the issues that people think are important. We have all our material that we're doing at the moment on a number of different sites. And although these aren't hyperlinked, you can actually look at the addresses of all those sites and visit them, and it will give you an up-to-date idea of what we're doing. What we hope will be the outcome of the project is to create awareness about key issues about how climate change affects public health, an understanding of what local people feel are their issues, what they think is important. We also hope to have learned of new ways of reaching, seldom heard communities. Those communities will have issues around climate change and public health, but they never really get to be heard in the public square. So if we can find new ways of doing that, that will really be good, because that can improve health service delivery. And I think the health authorities are very keen to find ways in which they can address and reach out to marginalized communities, because that's important. And I hope in the long term, we can develop community resilient communities within the areas we're working in. We're looking at, for example, developing climate change champions in the area we're working with. And we're working with EVA to try and link that up with the community champions they're developing as well. And if we could do something like that and develop climate cafes and other things, we can develop a long-term strategy towards developing community resilience in that area. And we will, of course, produce a final report, and that will be based around the outcomes and what we've all learnt and how we can take the project forward in the future. So that's the project that we're doing on climate change and public health. And if you are interested in any way and you'd like to be involved, we'd like to hear from you. it would be great if you could be involved, because we think it's an important project. And very often when local authorities produce their climate action plans, they don't address adaptation and they don't address climate change and public health in terms of how we adapt to what is going to happen in our future as the climate change begins to gather pace, and we will see the outcomes of that on the behavior of all of us and on the conditions in which we have to live. So, you know, join us, help us, get involved, and we would welcome you there. Anyhow,